Matt Kneale co-chairs the Doctors Association UK and is a junior doctor. He works in Manchester, joins me now. Doctor, you're at the front line. When you heard those words yesterday or today or read them in the paper, how achievable, how doable is it in your professional view? Good morning, sir.
Good morning. Thanks for having me. What has come out within this 5-point plan, it's just desperately short of detail, really. It just reads like another soundbite. We know the key issues that are affecting the NHS at the moment. We've known it for quite some time, actually, but nothing has been done. You can argue all day long about COVID and the impact on waiting lists and things like that. But ultimately, the problem comes down to staffing and funding. It always has done. We can argue all day long about what the correct amount of funding is, what the correct structure of the NHS would be. But I think ultimately we haven't got any evidence that going into sort of a private-based system, which I heard you spoke about briefly yesterday, Nick. Mm-hmm. I don't think the evidence is there for that. We've seen care homes that have largely gone private, which are failing. The care system is in disarray. We've seen private hospitals have their contracts taken off them. So I don't think there's any evidence to go that way.
But this doesn't work. Respectfully, just giving the NHS more money each year is not fixing the problem.
Well, I think people say the NHS doesn't work, but actually it always used to. It did quite a good job for a long amount of time. The problem is we have a very significantly ageing population.
Indeed. And brilliant doctors and anaesthetists and nurses such as yourself. I mean, and drugs. It's phenomenal. That's why I think there needs to be, and I'm not saying privatisation is the sole key, there needs to be it needs to be retooled in some way, Doctor.
It does, and I think it needs to be efficiently tooled. So it needs the correct amount of staff, as you say, the correct amount of equipment and drugs and all that sort of stuff. But the key thing is going to be about retention of staff. So it's no surprise, really, I think, with everything that's gone on, that we're seeing record levels of burnout in doctors and nurses. People are thinking now with the sort of pay that they're getting, they can get a much easier job elsewhere, whether that's in another country, working with another healthcare system, or whether it's working in another industry altogether. That's the same sort of thing we've seen as part of the care sector as well, which is adding on a massive delay in hospital,
Yes, I hear that. So lastly, the prospects then for the Prime Minister pulling this off are pretty gloomy, you would say, finally, Doctor?
I just think the track record, unfortunately, of the government and consecutive governments, actually, over the last decade, has been abysmal. We look at the last government with a little mini budget from this trust. It cost the economy, around 30 billion is what has been reported. That sort of level of funding is basically the short gap that we've seen over the last decade in the NHS. When you look at the data compared to the other major EU economies and how much they've put into their healthcare systems, it's around the same amount of money. So, if we're not reaching the correct amount of funding and we're not having the right policies put in place, what hope do we have, honestly?
Enjoyed our time. Thanks to you and thanks for what you do, Dr. Matt Kneale is coach.